Hello, this is Dr. Patrick Price, and I'd like to go on to the next lesson. So with Applied Kinetic Science, AKS as I call it, you have the 5 flows of the body: digestive, lymphatic, meridian, nerve, and vascular. The 5. When I did my tour going to 7 countries around the world, I'd studied with the shaman, the medicine men, the Tai Chi masters, the medical intuitives, different folks. And they kept saying the tubes, you must clean the tubes. And I didn't really understand, especially the old Indian goes, the tubes. He goes in, out, in. I says, you mean the digestive tract? He goes, yes. I was like, oh. So I started to realize what's important in each culture. And we know that in and out, a lot of stuff can happen in between. Especially we get constipation, diarrhea, just there. So from North America to South America to the Middle East to Far East, there's always these different styles of techniques, but it all comes down to the human body has these 5 tubes. So the digestive tract, and in and out. There's reflexes all for the digestive tract. From the small intestines to the colon, the ileocecal valve, they're there. The Meridian system is one that's overlooked in a lot of countries, but the Chinese, of course, know that there is a beginning and there's an end. There is a beginning and there's an end. And meridians have beginnings and ends. And this has to do with what? The yin and yangs. Yang is coming up from the sky, coming down. Yin, like the bottom of the foot, the kidney meridian starts at the bottom, works its way up to the kidney meridian where they end. These are yin meridians. So meridians move very fast. So digestive, lymphatic. So going to the second one, lymphatic system, having this clogged lymphatic system. The lymphatic system needs to be cleansed and opened. All these little trash cans are all over the body. So major areas of the lymphatic system are the neck, the cervical area, okay, the upper chest, especially women with breast, more fatty tissue than men. So the lymphatic system gets blocked in the upper chest area. And then you've got to look at the digestive tract area, which is where the diaphragm is. So here is a big lymphatic pump called your diaphragm. So anytime your lymphatic system is blocked, you got to look at the breathing. Breathing in different techniques will open up the lymphatic system. So the diaphragm can get very tight from stress, sitting and crunching the diaphragm all day. Also, in the legs will hold lymphatics. If you sit at a desk, stand all day, they'll get stagnant in the legs. You need to open up these lymphatic areas. There's certain areas and reflexes on the body to open up the lymphatic system here. You can literally open up a lymphatic in one leg, and she can lift this leg and notice a considerable difference of how light it is compared to the other side. So digestive, lymphatic, meridian, nerve. Nerve, obviously, if you're a chiropractor like I am, that is a major area of study in our that's our territory. Let's put it like that. So think of the big nerve, the brain. The brain's the big nerve. So you look at the brain down the spinal cord and all the nerves that branch out from there. So you have to look at each spinal segment as an area that you need to free up. Each bone has 3 ranges of motion, as we know: flexion, extension, lateral movements, rotation. So if a bone is stuck and not moving in one of those planes, you have to get that bone to move. And each bone is like its own individual joint. So major areas all related from the upper cervical all the way down to the tailbone. And the end of the tailbone is very important because that's the governing vessel of the meridian. It begins at the bottom of the tailbone all the way up the spine, the top of the head to the top of the lip, right here. That's the end point. So meridians, where they begin and end, always important to look at. So nervous system, adjust the spine, do the Chinese body work, open up all the meridians and the nervous systems. The chi, as I say, between the fingers, between the toes gets stuck. Other areas, you can look at nerve, you can look at it as meridian, you can look at it as many areas. So once again, digestive, lymphatic, meridian, nerve, and now the last one, vascular. Okay? So blood flow has very distinct areas on the body. These neurovascular areas, they call it. So one area, if you don't know a lot of these as a beginner, you just go to the head and neck area, and there's all these little tender spots all over the head that you can work on, where all the little capillaries, the 1 cell thick little arteries, and then you get little blockages. At stress, you have muscles here with the scalp. You have the fascia that covers that area. You have that dura that covers the brain. All these areas that constrict blood vessels, lymphatic flow, fluids in the body. So working with the vascular system, you can make changes in anywhere in the body just working on the head. So anytime I see something that's not working right, I look for a vascular spot on the head specifically. Other vascular areas, into the armpit area, they call the qua in Chinese. You can work with blood vessel areas in here. And I notice I can just push anywhere and probably find look at her, a spot right there, because everyone does what all day? They keep their wings down. So you want to open this up. And by the way, to live longer and be older is to do what every day? To open this area up. Get this open. So that's why Qigong is so popular, and yoga and things like this, the old ancient systems. So obviously the arteries and veins, like we said, the armpit area, the qua. And then right in the inguinal area, you have the areas of the femoral artery comes through. You can also go in here and compress. And there's some ancient techniques of getting into the palms and shutting off the arteries and releasing them. Is a Thailand technique that I've seen someone do. And they shut off the blood and open it to get the blood flow to back up and then flow. And back up and flow. So it releases the blood stuck in the legs. Vascular flow. So digestive, lymphatic, meridian, nerve, vascular, right? Digestive, lymphatic, meridian, nerve, vascular. Make sure you guys got it, because you can always just hold up your hands and go through it. So anytime I find something anywhere in the body that I'm working on, once you do your chiropractic, you adjust the spine like you normally do, you can always find a spot that shows up in the reflex testing. Okay, over here where the spleen is. Spleen has to do with these muscles here, the opponents. Hold this together, hold it tight, and she has no power there. But if she touches the reflex, hold it strong, it locks, it's solid, okay? So now I know that's the active reflex to work on. Maybe she's been having some hand strength that she notices, but spleen is also has to do with your immune system. Okay, you can relax here, but hold this. So here's what I'm gonna do. Hold this strong. Digestive, lymphatic, meridian, nerve. Nerve gives me hit. Just by giving the verbal cues to her subconscious, she picks it up and the body knows, guys. Digestive, lymphatic, meridian, nerve. All right, so nerve check. As she holds the reflex, where am I going to start with nerves? Hold it strong. How about the neck? Now I scan the spine by going through here, the top of the body, and look, right away her upper thoracic area show up. There it is. Okay. Now here's what I'm going to do. Now I'm just going to touch the areas. I'm going to go to the lower cervicals, hold it strong. Now I'm going to go to T1, middle, right, left. I'm going to go to T2. There it is. Look at there. All right. So there's many ways. You can also use like the J-Tech, all the little reflex devices. You can go in there and do it very gently on somebody as well. You can go through and mechanically adjust like we're all trained to do in school. Or you can do something a little different. Hold this strong. So I'm going and going exactly where it is. Okay, now let that down. What I'm going to do is just go in and I'm just going to impulse it. And you see she's going to show that that's tender. I'm going to hold the spot. I'm going to put pressure. And I'm just going to impulse it. Breathe. And out.
Oh.
Good. I'm going to recheck it again. Strong. Now, let's check the reflex first. Hold it strong. Strong. It doesn't show up. Now, just to verify, remember, for new doctors especially, you need proof that this works. Some people need to challenge themselves. You know, I'm thinking, wow, this stuff looks really strange, Dr. Price. The idea is you need to know yourself, that you become confident in it, that you have several checks to make sure that you, the doctor, are very confident that you just made a change in this person's body. We know the reflex is showing up, that's simple. But as she holds the muscles back, the opponent's muscle, hold it strong. And I pull really hard, now it's back what? Solid. But another check, she touches it, hold it strong, boop. So that's a third check you just did. You're checking how the energy flows in the body. So guys, this is your introduction to the 5 flows. Get to know them, because maybe you just do the chiropractic and you're adjusting the spine and you want to add one more layer of health to that person's body. That means go back and do the details, the fine work. That muscle's strong again. Let's make sure it's strong in every angle, especially if they have a hip, or like her, she had a shoulder issue, right? And so you fine tune the human body and you follow the energy. The body will always show you where you need to go. Guys, I hope this video helps you. Be a better doctor, be the best doctor. I'm Dr. Patrick Price, and I'll see you in the next video.